Guys, basically, the medical billing means the process of sending the clients to the insurance on behalf of the provider. Okay, first note it down, and then we'll go ahead with RCM cycle. Basically, RCM means RCM stands for Revenue Cycle Management. It is the complete process of handling patient billing. That is from patient appointment to under final payment collection. And the steps involved in RCM are um, first step it is scheduling the appointments, and then here scheduling the appointments means patient schedule an appointment with the healthcare provider, and the second step is registration. That means patient provides his or her personal information, and they need to submit their insurance information also. And the third step is eligibility. Eligibility means a healthcare provider will verify that patient's insurance is active or not for that particular date of service. Hello, did you got my point?
Guys, respond to her. Uday and Imran. Respond, because she took her time to explain you. So respond.
Yes.
Okay.
Yeah, yes,
Okay.
sir. No, got it.
If you have any doubts, ask me. Okay.
Sure, sure. The lines are very
Yeah,
simple
sure.
to understand.
Okay.
It is
Okay.
very basic. So,
And the first step is utilization review. Here, utilization review comes like the insurance provider reviews whether the medical service is necessary and covered. I mean, here in healthcare, I mean, if we go to hospital, if you are having only fever, they don't give any services like operation or something like that, right?
Yes.
Medically necessity means that's the thing. I mean, only for the emergency services, only in emergency cases, they will give the treatment. That we call it as medically necessary in healthcare. Okay.
Okay.
And the fifth step is initial payment. I mean, patient or insurer makes an initial payment. This comes under rare scenario. Why? Because sometimes insurance won't cover all the expenses, so patient need to pay some amount initially. After that, we will be able to know whether it is co-pay, co-insurance, or deductible.
Okay, 1 second,
In
Aruna.
the end of
Do
the
you guys
process.
remember copay, co-insurance, deductible, guys?
Yes, sir.
This
Yeah.
is included in our project also. In our patient for patient while booking, there is option of copay. All this I have included. So for your information, yeah, please proceed.
Okay. And the sixth step is describing the charges. Here, the healthcare provider records services provided and their charges. I mean, here services means the treatment they provided. They will just make a note about what treatment they provided and how much charges. It's all about that. And when it comes to step 7, the medical coding team will be involved. Here, the services are converted into standardized medical codes for billing. I mean, here in healthcare, we are not able to tell the disease name and the treatment we provided. I mean, why? Because it's against the HIPAA rules and the CMS guidelines.
Okay, 1 second.
Ah,
Aruna, can you take
yeah,
a situation regarding this HIPAA and CMS? Like how exactly? Can you fit into the situation and explain them?
yeah, sure. One moment, please.
So I already told you what is HIPAA. It's basically protecting the patient health information.
Patients, yeah.
And CMS means what? Center for
Center
Medicare
for
and
Medicare and
Medicare
Medical
Services.
Services.
So, example, you know what is Medicare and Medicare? All of you, one of the topmost question asked in the interview. What is Medicare and Medicare? Do you know all this?
Yeah.
Medicare and Medicare, all of you, Uday and Swapna Imran. Medicare
yeah,
and
those
Medicare.
are US government-based health payers.
Okay, what is the difference? Medicare and Medicare?
Okay. For I don't
I
div
think one is for physically disabled or for them, and another
Yes.
one is for above a certain age people. I
60
just
Very
don't
years.
exactly don't remember that. I think this is a basic difference between those.
Yes. So these are a kind of when one patient is currently opted for this Medicare or Medicare, they will be going into the private hospital. Let's assume private
Yes.
hospital, and now the hospital has to follow CMS guidelines because the patient is opted for Medicare service. So that hospital needs to follow some rules and regulations as per the Medicare and Medicaid government agencies. That is called CMS guidelines. You can search. This is one of the keyword that the recruiters are more look for healthcare business analysts. CMS guidelines, HIPAA. Okay, HIPAA also, I told you some scenarios. So basically, role-based access. Only the authorized users are eligible to view patient health information. no other, and we need to protect and ensure that it is not exposing to anyone. Yeah, continue, Aruna.
Yeah, guys, basically, Medicare is for the people who is above 65 years of age, and in some cases for disabled people also. And Medicaid is all about the poor people who is below the poverty line. Okay, just remember that.
Okay.
Did you got my point?
Yes,
Yes,
yes.
Yeah. Okay.
Aruna,
Yeah.
I'm sorry to interrupt. Could you please go back to step 6? I just
Yeah.
want to
Okay.
understand how the
Okay.
describing charges. Healthcare provider records services provided and their charges.
Yeah.
So, when you say healthcare provider,
Hmm.
is it insurance payer we are talking about, or the
No,
provider?
we are speaking about doctor.
Correct. So, how is doctor going to record all these services and the charges? Where is he going to provide these charges?
Yeah, in the patient's medical records itself.
Okay,
He will.
so those
Hmm.
records will be seen by payer and patient both, or do we have any
Yeah,
matrix here?
remember by both. Able to see
Both.
by both. Yeah.
Okay, so he'll upload these into EHR or EMR.
EHR.
Okay, understood.
Okay.
Thank you.
Okay. I mean, here the step 8 comes under submitting claims. Here submitting claims means claim is sent to the insurance company for the payment. Obviously, after providing the treatment, provider need to submit the claims to the payer for getting the payment. Under the step 9 is remittance processing. Remittance processing means insurance company process the claim and responds with payment or explanation. Here, payment or explanation, we call it as explanation of benefits. I mean, even if the claim is denied, also we will get the explanation of benefits in the form of denials. And even if the claim is paid, also we will get the explanation of benefits in the form of payments. If you have any doubts, ask.
Clear. But I have one more question. So,
Yeah.
usually a provider or a hospital checks if the patient is eligible for insurance or not. So,
Yeah.
do they check it before the patient gets any treatment or services, or after they get any treatments or services, or it happens in both ways? How?
It happens in both ways. Why? Because uh, sometimes providers will give the treatment.
On an emergency basis, maybe
Yeah.
it
In
is
both
emergency.
cases, it will happen.
Okay, understood.
I mean,
Thank you.
sometimes they will take the permission from the insurance before providing the service, and sometimes they will take the permission after providing the services. In both the cases, they have to take the permission from the insurance.
Okay.
If insurance is not active, then they will collect from patients, so they don't have any issues.
Okay. So when the patient is taking or opting for any kind of insurance, so do they know what are the services they will be getting, or it
Yeah,
only
initially
depends?
only they will be able to know, right? This and all insurance will cover these kind of services. After knowing
Mhm.
about all of that, only they will take, or they will opt
Coverage.
for it, right?
Yeah, all whatever the cover services. Yeah.
Yeah, coverage. Because there is also a copay and there is also
Yeah,
some of the
co-insurance
services
and
that might
deductible.
not correct that might not go into the payer's coverage. So I'm just trying to understand here. So will that be already that information will already be provided to the patient earlier before they choose for this insurance, or how it works there?
Oh, okay. Your question is okay. Got it. I'm going to clarify your doubt that if patient take the treatment and the provider said like this insurance will cover like $2,000. Okay. After done with the treatment and the provider submitting that treatment and the services to the insurance, but insurance paid only some $1,500. Okay.
Mm-hmm.
They will tell like only this much amount is covered, and then the patient only need to pay the remaining amount. This comes under patient responsibility, whether it is co-pay, co-insurance, or deductible. Okay.
So my question here is, will payer inform about this to a patient already beforehand, or it totally depends on what kind of treatment that provider is going to provide for the patient?
It's all depends on the insurance acceptance and
Okay, understood.
yeah.
So it will be before the treatment only, no?
No, after done with the treatment and after how much amount is going to be covered based on the
Right.
scenario.
So here, what usually happens is whenever we go for a treatment, right, for like
Hmm.
surgeries or something,
Hmm.
we go to doctor and they'll say you need to get these kind of treatment or services, for this process or procedure. So based on that, what we'll do is we'll contact the insurance people saying that, okay, this is the services that I'm going to get for this procedure, right? So
Yeah.
based on that, they will, based on the insurance that I took, and also based on the services that I'm going to take, they'll provide some amount. Okay, this much amount will be provided, or you can claim so and so amount. So based on that, the patient, or let's assume I'm a patient, so I would know, okay, so and so amount is what the insurance will be paying me, and I can get ready with the rest of the amount, and I can go
Ah,
for the services. If not this provider, I can go for the other provider who's charging me less, wherein all the services will be covered in the insurance, which they could help me with the amount. So this
I
option
mean,
we have in India. So I'm just trying to understand how does it work in the US healthcare.
in US we can't go everywhere. It will be if insurance, if we take the policy after that, if it is only in network, we have to go to the in network provider only.
Okay.
Mm.
What if it
Uh,
is out of network? So can patient go to any provider?
so we can't go like that. It depends on policy what we are taking.
Okay, so here the payer and the provider will stay in connect. It's whatever provider is having, whatever the insurance types.
Yeah,
Patient
I
can only
mean,
choose those providers with those insurance types and contact the provider for any services or treatment.
yeah, both of them will have an agreement basically.
Oh, okay, got it. Yeah, we had this. Actually, Shailish already told about this.
Yeah.
Okay.
Yeah.
Here in healthcare, after done with the treatment, insurance will tell like those services are not covered. Most of the in most of the times it will happen like that. So that's why obviously it will comes under patient bucket.
Yeah, but that will be difficult for
Uh,
patient. Anyway, it's
yeah.
it's it's US
Yeah,
healthcare.
your question is when it comes to, patient responsibility, majorly three types are there. That is copay, coinsurance, and a deductible. When it comes to copay, initially only patient has to pay a fixed amount, okay?
Mhm.
And when it comes to deductible amount, a patient pays before insurance starts paying. In any case, patient has to pay before if it is patient responsibility.
Okay.
Only when it comes to coinsurance, only specific percentage patient will be paid.
So there is no insurance that pays the full amount for any patient. Patient has to pay from his pocket, though they opt for any insurance.
Actually, most of the times it's not like that. Patient will pay if it is patient responsibility. Our services are not covered under the treatment. Only these two scenarios. If it comes under patient responsibility, only three different categories are there, right?
Mhm.
That depends.
Copay, deductible, and
Coinsurance.
insurance. Okay.
Yeah, that's the thing.
Okay, understood.
Yeah. Okay. Okay. Here in step 10, a third party follow-up. Third party follow-up means basically in medical billing, that is AR follow-up. Provider follows up with insurance company if payment is delayed or denied. Actually, a provider won't interact with the payer directly. Medical billing team, especially AR team, will work on this, and they will work on the outstanding claims and reimbursement
Okay.
issues.
So here kind of billing team guys. So everyone, I shown you one visuals, right? Earlier
Correct.
billing.
I remember.
Oh yeah.
Yeah.
Like
Yeah.
CMS 1500, EDI, all those you saw, right? That is she was currently talking about. Yeah.
Yeah. When it comes to step 11, provider collects remaining balance from the patient. If the service is not covered or if insurance didn't pay the total amount, in that cases, provider will collect from the patient. It's all about RCM. I hope
So,
you guys understood.
so this is high
Yes.
level, very high level RCM. Yeah. So now, Aruna,
Yeah.
also brief them the workflow between this billing team and the payer. What exactly you people does?
Yes.
Can you explain the
Okay.
user journey for that also?
Yeah.
Yeah.
One moment.
So can you write it down like in short, every step, and explain them so that they can understand better? Open MS
Okay.
Word or anything. So the reason I wanted you to understand these also because BA will be focusing on these also, guys, as a business analyst. So basically, you will not be implementing, you will be analyzing how the process is working in case if any inefficiency blockers are happening for this process, the claims and all these things. You as a BA need to undergo with the deep, thorough research, thorough things about the identifying the issue. So that means you need to understand about the entire flow, how it is happen, how exactly it works in the healthcare. That is the main expectation. Without understanding, how do you identify the root cause? How do you bring the solution? Not possible, right? I have few scenarios, but before that, let's. Okay, Aruna, you can tell. Yeah,
Okay.
she is currently going to explain the user journey of a billing team and payer. So after that, how exactly BA will fit into the situation, I will let you know. Okay, pay attention to her.
Okay.
Okay.
I mean, here I am telling AR caller workflow. As an AR caller, after logging to the particular software, whether you can take it as Epic or Advanced MD, or you can consider it as any software. There we need to enter
So what she's
patient
trying to
unique
say
ID.
is a billing team will have
సరే
a
నేను అది
dedicated
మాట్లాడతాను. ఇంకా
software.
ట్యాపులు పైపుల వరకు ఏదైనా అంటే చేపించుకో వీళ్ళతో.
Okay, what she's telling is a billing team will have a dedicated software. So in my previous session, I have shown you one tool, but I didn't given any name. So, sorry, Aruna, you can consider one name, software name. Can you consider any one
Okay.
of the name?
Yeah, I
We are
can consider
considering.
Jyfin.
Yeah, Zyfin. So consider, guys, everyone, I shown you some visuals, right? Like how exactly the claims will be processed to the payer. So consider the tool as a Zyfin. So Zyfin, yeah. Tell me, yeah.
Yeah. Yeah. In the software, we need to enter the patient ID. I mean, here in healthcare, for each patient, we have unique ID. You can call it as a patient ID. Mm. After entering that patient ID, we'll be able to see the information regarding the patient and which treatment they had taken and which provider had given the treatment and everything we will be able to see, and even
Uh,
along with the
ICD, CPD codes also
yeah
you will be able to
everything.
view. So you guys all know, right? What is ICD and CPD codes? So
Yes.
provider will be also
Yes,
entering.
sir.
You can get these ICD, CPD codes in various team departments. From the billing team, from the provider, is someone is going to enter. So you need to know what is ICD and CPD. And in our project also, I have included ICD and CPD visual, if you remember. Okay, fine. Go ahead.
Okay, as an AR caller, initially after reviewing the details, we need to review the EOB. That's the mandatory step. After reviewing the EOB only, we will be able to know whether the claim is denied. I mean, denied means temporarily rejected, or it's insurance stop the payment temporarily. Okay, it's not permanent. Did you got it?
Okay, EOB means what? Explanation of
Explanation of
benefits.
benefits.
So who is going to process to billing team, AR caller team?
I mean, we will get it from insurance.
Yes, just say them that. From payer side,
Yeah.
they will be sending it to the billing team, provider, I mean billing team. So these, upon reviewing this EOB, they will come to the conclusion whether the claim is approved or rejected. You mean, right? Denied. I mean, for
Yeah.
temporary. So can you mention that point only? Yeah.
Yeah. Okay. After reviewing the claim only, after reviewing the EOB only,
EOB.
we will be able to know whether the claim is denied or payment is made. Mm,
Okay, first of all, can you start with the how exactly the claim CMS 1500 and this has been processed to the payer, and then you explain.
okay. Basically, after done with the treatment, after the treatment is completed, provider from the provider side, billing team will submit the claims to the insurance company, and then we will work as a third party follow up here in RCM cycle. Okay, we will get that response from the insurance. The response is called as explanation of benefits here.
Okay, talk about the CMS 1500 and how electronically you will sending, and we were discussed about the online, paper, all that. Can you please talk over your total detail? Can you please talk? Let's
Yeah.
talk
Okay.
about how exactly claims are sending and who is
Okay.
sending, and what is the response we get. We are going to
Yeah.
get
Okay. We
response
got
in
it.
the form of EOB. From that only we
Yes.
are going to determine
Mm.
whether claim was rejected or approved, denied,
Okay.
sorry. So
Yeah.
can you please explain that journey,
Yeah.
how it
If the
works?
claim is denied, then as per the product policies and guidelines, we need to appeal.
What
Here,
is
appeal
appeal?
means
Hmm.
we are just asking them to reprocess the claim.
Okay, please make a note, everyone. Appeal means reprocessing. Okay, Aruna, quickly, can you please write down the step, explain the steps that as a billing team, like we will be sending the claims through EDI format.
Yeah.
Then the payer
Yeah.
will review. Can you explain
I have
that
a
steps? I
question.
want to talk on that. I want
Aruna,
you to talk.
I have a
Yeah.
question
Yes.
here for appealing. So, who does this appeal to reprocess the claim?
As an AR caller, we only
Billing team.
responsible. Yeah.
Okay.
Medical
Okay.
billing team is responsible.
So, how does the billing team or AR caller know that there is a need to reappeal or appeal?
It's all about the product structure, and I mean, if claim is denied, then we need to make the call and we need to ask for reprocess the claim. That's the thing we need to follow as an
So
AR
for,
caller.
okay, so for every denial, you'll be appealing.
Yeah, for most of the times we will be appealing.
So, what kind of denials you won't appeal?
No, denial will be happening
No,
from payer side. Okay. For example, if there is any discrepancy with the claims or if there is any coverage amount that is not covered. So any discrepancy, if they have found, they will deny. And there is,
anyway, we need to appeal, okay, for each and every denial.
Okay.
Then only they will reprocess the claim from provider's office side, okay. 835 is all about receiving the payment details from the payer. Here you can consider the scenario of EOB also. If in the EOB, if the payment is made, then you can call it as EDI 835 also.
yeah, getting response from the payer, which is nothing but 835 we call EDI 835. So
Yeah.
example, she said that EOB. So we usually get the EOBs from the payer side. So that is called, we call it as EDI 835.
If the payment is made, then only we can call it as 835. Yeah. When it comes to EDI 270, it's all about requesting the eligibility request. It's about whether the patient is eligible for the data service or not. If we get the response from the insurance, then you can call it as EDI 271. You can remember one thing, whether it can happen through call or we can just go ahead and check through the payer portals. It will happen in two ways.
Okay, who is doing this? Billing team, right?
AR,
Yes.
yeah, AR caller.
So either it could calling them or else
Either
we
it could
can
be a
doing,
call or checking through
yeah.
portals. And EDI 276 is all about asking for the claim status, whether the claim is denied or not. And if we get the response from the payer or insurance representative, we will call it as EDI 277. The question we are asking is EDI 276, and the response we are getting is EDI 277. Okay, it's all about one is question and another one is response. You
Understood.
can, yeah.
Okay, claim status
Yeah.
response. So guys, anyone has any doubts with this?
Yeah, like Shailesh, as a BA, we need to remember and memorize all these codes.
Yes, that's what
The work
healthcare is all
scenario, right?
about then.
Okay, good.
You will be
Good.
working on this. You are all this. You are going to work on this as a BA, healthcare BA, on regular basis. You will frequently use all these.
Yeah, okay, good.
Okay, Aruna, I hope regarding these claims, I hope you covered everything, right?